me introduce myself again. My name is Daniel Kertesz. I'm the WHO representative in Thailand. First, I need to tell you, Dr. Dwangvadi, thank you very much for your introduction. I know Dr. Dwangvadi is a former colleague at WHO, and it's an honor to meet you and an honor to be with you here at this session. I have to confess something to you. I'm not an expert in either patient safety or accreditation. My background is in infectious diseases and emergencies. Like was mentioned, I spent a lot of time in Sierra Leone during the Ebola outbreak. During that time, I learned a lot about patient safety. Of course, this was critical during the Ebola outbreak. But I would like to thank very much the HAI for inviting me to speak here. I hope what I have to say is a little bit interesting to you. I'm not sure I'll cover everything that Dr. Dwangvadi mentioned, but I hope that I'll at least be able to maybe provoke some interesting discussion. Some of you might be asking, why has WHO been invited to speak today? How many of you know the WHO or know well the WHO, how it works? You can stick up your hand if you know WHO. If you don't know WHO, that's great. Some of you know WHO, okay. Well, what I thought I'd do is I'd begin to talk a little bit about WHO and what it is that we do and what is our role in the area of patient safety. I'll talk a little bit about what WHO has done in this area. And then at the end of the presentation, I'll mention the Sustainable Development Goals, why they're important, and where patient safety fits into the Sustainable Development Goals. So this will be a little bit the outline of my presentation. Like I say, I'm going to present a little primer on patient safety. I'm not sure if all of you are experts in patient safety, but I'd like to talk a little bit about some of the basic concepts in patient safety before I move on to talking a little bit about some of the global initiatives. So first of all, who is who? Who is the WHO? What do we do? Simply put, the WHO is the United Nations agency that specializes in health, okay? So we are the experts in the United Nations for anything related to health. When people think of the WHO, they often think of people like Dr. Dwangvadi and myself. They think of the people who work for WHO, the organization, the WHO. That part of the WHO that we call the Secretariat. In reality, WHO is made up of two very important organs. The Secretariat, myself, is one of them. The second is called the World Health Assembly. For those and I'll talk a little bit about that in just a second, but for those who've never seen the WHO, who've never been there, you should go sometime because it's very beautiful. This is our headquarters building located in Geneva, in Switzerland. So the first organ of the WHO is called the World Health Assembly. The WHO, it's called the World Health Assembly, abbreviated to WHA. It is the supreme governing body of the World Health Organization. It meets once a year in Geneva, Switzerland, and it is attended by delegates from all of the 194 member states of the World Health Organization. The delegations are usually represented at the ministerial level. So basically, once every year in May, all the ministers of the world come to Geneva and they meet to discuss issues about health. The World Health Assembly is like the board of directors of the WHO, okay? This is a photo, I think, of the WHO in 2015 when the president of Germany, Angela Merkel, addressed the World Health Assembly. So this is a very august and important body that really directs the work of the WHO. And I'll be talking a little bit about some of the things that they've resolved. So the main function of the WHO, the WHA rather, the World Health Assembly, is to adopt international conventions, and really importantly, it's to make recommendations to all the countries on specific issues related to health. And this is why I'm talking about the WHA, because in specific issues related to patient safety, accreditation, it is the World Health Assembly that proposes and ratifies recommendations for use across the world. So if a resolution is made by the World Health Assembly, it means that all of the ministers, health ministers of the world, have decided that this is an important issue and that this issue should move forward, okay? Among other things, the World Health Assembly elects our Director General, okay? So our Director General is elected by all of the ministers of health of the world. And of course, they review and approve our budget. So if they want to direct resources of the Secretariat of my office to patient safety, they will tell us that that is exactly what they want to do. So the second organ, so I've talked about the World Health Assembly. The second important organ is the Secretariat. That's me. That's Dr. Duong Vadi in her former life, okay? It's all of the staff of the organization who help the member states, the countries, to implement the resolutions of the World Health Organization. So if there is a resolution about patient safety, it's the Secretariat, myself, my staff, that help the countries to implement those resolutions. We have about 8,000 staff around the world. And as I said, the Secretariat is led by our Director General. She's from China. Her name is Dr. Margaret Chan. The DG is elected every 5 years, okay, and he or she is allowed to serve up to 2 terms. And it's quite significant that in May of this year, we will be electing a new Director General. So the member states will be electing a new Director General. We have 6 regional offices, and this is important because Thailand belongs to one of our regional offices. We belong to the Southeast Asia Regional Office. There are 11 countries, and we are led by our regional director, Dr. Poonam Ketrapal Singh. Okay? And finally, the WHO has over 140 country offices, mine included. Okay? So the WHO country office in Thailand is located in Nonthaburi. Okay? We have about 29 staff there, national staff and international staff. You are all welcome to come anytime to visit us. We're based in the Ministry of Public Health in the Department of Disease Control building. So the World Health Organization has a constitution. Since April 7th, 1948, or 69 years ago, our constitution was made. These are the key principles of the Constitution, and they really sum up the mission of the WHO. This is what we do. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Okay, that's really critical. The enjoyment of the highest attainable standard of health is one of the is the fundamental right of every human being. And I think from this you can see why the WHO is very interested in the concept of patient safety. The whole concept of patient safety fits into our Constitution very, very well. Now I'd like to take some time to discuss some concepts around patient safety and what we mean by the term. Is everybody in the room an expert in patient safety? Yes? A little bit? No. Okay, I'm going to talk then a little bit about patient safety. I'm going to present a little primer on patient safety, just so that we're all oriented. This, of course, is an excerpt from the famous Hippocratic Oath. If there are doctors in the audience, you will have recited this oath when you graduated, when you matriculated. I did. The oath says that I will prescribe regimens for the good of my patients according to my ability and judgment, and do no harm to anyone. Okay? I will preserve the purity of my life and my art is healthcare. So the Hippocratic Oath is really about protecting people. Okay? It's about protecting patients. I talked previously about our Director General. There she is, Dr. Margaret Chan. And she has said, and I think Dr. Duong Vadi actually quoted her previously, but I think it's worth repeating, that our knowledge of diseases and technological innovations have all contributed to increasing life expectancy in the 20th century. That's clear. But one of the greatest challenges is not keeping up with the latest clinical procedures or the latest high-tech equipment. It is really about delivering safer care in complex, high-pressure, and fast-moving environments. In such environments, things can go often wrong. And that's really what she is alluding to here, is how we protect patients. It's the whole concept of patient safety, and how we do it in a very complex and very high-pressure clinical environment. So what are really the main messages in relation to patient safety? There is now overwhelming evidence that significant numbers of patients are harmed from healthcare. Okay, we know that. Patient safety is an issue in all countries that deliver health services, whether these services are privately commissioned or funded by government. So a lot of patients harmed, and this is a problem all over the world. Studies have shown that many adverse events in the clinical care context are preventable. One study found that more than 2/3 of the adverse events in a sample were preventable. 28% were due to the negligence of a health professional, and 42% were caused by factors other than negligence. So a lot of preventable adverse events occurring in the clinical care context. Over the last decade, we've learned a lot about why this happens. And we've learned that adverse events don't occur intentionally, okay? They rather occur due to the complexity of healthcare systems. And I'm going to talk a little bit about that and why that is, and present some interesting models that show why that might occur. And when so many different types of healthcare providers are involved, it can be very, very difficult to ensure safe care. The situation in developing countries merits particular attention. Now, Thailand is not a developing country. It is a upper middle income country. But where I worked all of my life in Africa, the issues around patient safety were front and center. Hospitals were simply unsafe places to go. And many of the features of patient safety programs do not involve financial resources, but rather commitment of individuals to practice safely. So this is not something like the eradication of polio, which requires millions of dollars. This is something that can be done relatively low cost, relatively locally. So I just want to talk a little bit about the burden of unsafe care. How big a problem is it? In developed countries, and again, I think this statistic was already quoted, about 1 in 10 patients suffers an adverse event in hospital, okay? That means that for every 10 people that goes into a hospital, 1 in 10 will suffer an adverse event. This rate is higher in transition countries, like Thailand, and it's extremely critical in developing countries. Again, like I say, countries, for instance, in Africa. There are really 6 main types of adverse events, and I just want to go over them very quickly because WHO has some very specific initiatives that address these events. The first are nosocomial infections. We're all familiar with healthcare-acquired infections. 1 to 2 out of 10 patients acquire these, mostly in the intensive care setting. $5 million in Europe, 5 million occur every year alone in Europe. 5 million nosocomial infections every year in Europe. And you can imagine what a problem this is. Most of these infections are related to complex microorganisms that live in hospitals. And you can imagine what a problem that is for another global health priority, which is antimicrobial resistance. Okay? So decreasing nosocomial infections, improving patient safety by decreasing nosocomial infections is a critical intervention for antimicrobial resistance. The second adverse event is medication errors. We know that these compromise a significant burden with up to 1.5 million persons harmed every year in the United States from medication errors. Unsafe surgery, wrong patient, wrong site, wrong organ, etc. These are 1 million deaths each year from complications of surgery, which are listed here. The fourth is compromise to patient safety that occurs during clinical handovers. Okay, the handing over patients from one shift of doctors to another, from one shift of nurses to another. The miscommunication of information is a critical problem that can lead to some patient adverse events. The fifth is related to injection safety. 70%, as you probably know, many of you are involved in primary care, 70% of injections in the primary care setting are not needed, okay? And they account for many cases of hepatitis B and hepatitis C globally now. And finally, there are a large number of other risks. I've talked about 5 of the most important ones, and these are, I think, the 5 that we really need to keep in mind as we think about how we can address this problem. So not only the burden of compromised patient safety is most tragic when we think about human beings, okay? But it's really important in the era of escalating costs and the need for more efficient health systems to think about the economic burden of unsafe care, okay? In the United States, the annual impact of medical errors and adverse events has been estimated at $60 billion. Can you imagine what the world could do with $60 billion? The budget of the WHO is, I think, $4 billion. I mean, $60 billion is a massive amount of money lost to compromised patient safety. The impact of, for instance, of nosocomial infections alone that I talked about before accounts for about 25 million extra hospital days, or about $6.5 billion in the United States alone. So the economics, not just the human burden, but there is a huge economic burden in relationship to patient safety. One of the major messages of my presentation is that patient safety issues are systems issues. And I think this is really a major message coming out of certain global initiatives and regional initiatives. Dr. Lucien Lippe, who's a Harvard professor and has been very active in trying to improve the medical system to reduce medical errors, has said, humans fail because the systems, tasks, and processes in which they work are wrongly designed, okay? This is, of course, applies to patient care settings. So it's not necessarily the people, it's the systems. Another person who's made a significant contribution to this field is James Reason. He's a professor of psychology at the University of Manchester in England. Some of you may have heard of him. He created what is called the Swiss cheese model of accident causation, okay? I'm going to talk a little bit about it because I think it's very, very interesting. And it's used in risk analysis and risk management. And the model applies to health, but it also applies to aviation. It applies to anything, any complex system where something can go wrong. He stated that only a systems approach, okay, as opposed to the more common approach of blaming individuals or based on individuals, only a systems approach will create a safer healthcare culture. And why is that? Because it is easier to change the conditions under which people work than it is to actually change human behavior. Okay, it's easier to change the system, the hospital system, the healthcare center system, than it is to change the behavior of the people. And he used examples from industry to demonstrate this, and he used what is called the Swiss cheese model. And I like this because I like cheese, but also I like to show this because it's kind of interesting. Have any of you heard of this model before? Okay, I'll just go over it very quickly. He basically, many of you may know Swiss cheese. When you slice Swiss cheese, each of the slices has sort of holes in it. And Professor Reason argued that the occurrence of adverse events can be likened to Swiss cheese, okay? Every step in any process has the potential for failure, okay, to varying degrees. So consider each hole in the slice of Swiss cheese as an opportunity for a process to fail, and each slice of cheese as a potential defense mechanism against failure. An error may pass through one layer, but in the next layer, the holes are in different places, and the problem is caught and deflected. It does not pass through. Each layer is a defense against potential error occurring, and I think that you can see that here in this diagram. In the patient care context, the defenses which prevent minor mishaps turning into major failures include standardized procedures, such as guidelines and protocols, physical barriers, such as the separation of different types of high-risk drugs, information such as on patients, such as patient allergies, and decisions that clinical staff take based on their training and their experience. For a catastrophic error to occur, and I think many of you may have had experience with very serious errors, the holes need to align for each step in the process, allowing all defenses to be defeated. So the holes have to line up so that the problem passes through each layer of defense and you end up with the serious problem. If the layers are set up with the holes lined up, it means the system is flawed. Okay? It's flawed because it allows a process that starts at the beginning to progress all the way through to the outcome. So you can look at each slice of cheese as an opportunity to stop an error. So in the systems that you have, in the context where you work, you can think of the various systems that you have as slices of cheese. And the idea is to make sure that if an error passes through one slice of cheese, that you have a second defense to catch the error, and then a third defense and a fourth defense. This is a really critical concept, a really critical basic concept in patient safety. How can we reduce adverse events in patient care settings? And it's not by punishing individual practitioners. The key is to, as I said, is to fixing dysfunctional systems. Healthcare providers should look beyond healthcare mistakes or failures in care and understand that there are many factors associated with an adverse event. This is really about about asking questions about the underlying factors and encouraging others to think about errors from a systems perspective. This means asking questions about possible causes by using the phrase, "what happened," rather than "who was involved." One method that we used in the Ebola outbreak when I was in Sierra Leone, when healthcare workers were infected, is we kept asking the question, why? Why did this happen? Okay, why did that happen? Okay, why did that happen? Why did that happen? This is critical. Rather than saying who, it's really asking why. Why, until you get to the bottom of the problem. And as you ask why, you'll see that you'll see the flaws inherent in each slice of cheese, in each system of defense as you move along through your system. So many factors and structures and processes contribute to unsafe care, complex and high-pressure healthcare environments. I think we've talked about communication failures and ineffective healthcare teams, poor reporting and learning from errors, poor quality clinical care, lack of involvement of patients themselves in the care, unsafe clinical practices resulting, again, in nosocomial infections, surgical anesthesia errors, unsafe use of medications, unsafe blood practices, and of course, human factors. The relationships that members of a healthcare team have with each other. And I think that you, as healthcare leaders and providers, should, when you think about improving your own systems, follow these basic precepts. Really avoid blaming when an error occurs, okay? There are more opportunities, look at opportunities that you have for reviewing the systems that lead to errors in your healthcare contexts. Practice evidence-based care, and this is coming from WHO. WHO is all about evidence-based guidelines, using evidence to create guidelines and resolutions. So healthcare providers should learn how to apply evidence-based guidelines, and they should be aware of the role of evidence-based guidelines and how to improve them and apply them. It's really critical to maintain continuity of care for patients. The health system is a continuum of care for patients and their families. Understanding the journey that patients make through the health system is necessary to understand how the system can fail, okay? Important information can be missed, outdated, or incorrect. This can lead to errors. It's important to be aware of the importance of self-care. Healthcare workers should be responsible for their own well-being and that of their colleagues. Healthcare providers in difficulty, who are exhausted, fatigued, who have problems related to mental illness, should be encouraged to seek the appropriate professional help. And of course, this goes without saying. It's part of the Hippocratic Oath. It's part of why we're in healthcare, to act ethically every single day. So just to summarize up to now, unsafe care and harm to patients is everywhere. It's a global concern. Patient safety is still not a priority in all countries. I can see, even just after a year of being here, in Thailand, patient safety is a priority. But in many, many countries, this is not a priority. Adverse events can happen because of errors in human behavior, structural factors, or poor processes in healthcare. Learning and lessons and learning about errors and system failures in industry can be used to develop frameworks for improving patient safety in the healthcare context. And that, I was just talking about the Swiss cheese model. That comes from industry, and it can be used to think about how we improve patient safety in healthcare model. Okay, I'd like to talk a little bit about patient safety and WHO. Okay, I've introduced you to WHO. Now you are all experts a little bit in how WHO is working, and I've talked a little bit about important concepts in patient safety. Okay, especially the whole idea that patient safety is about systems. Okay, I'd like to talk for the next few minutes about what WHO is doing in the area of patient safety, and we're really leading in the following 4 areas. Okay, in convening global leadership and developing policies and strategies around patient safety, in promoting collaboration and partnership. Okay, in developing standards, guidelines, and tools, and in the measurement of trends and progress. I should indicate that for any health issue, whether it's infectious diseases, whether it's it's patient safety, whether it's health systems, these are some of the core functions of WHO. Okay, leadership, policy development, convening collaborations and partnerships, and developing and supporting countries to develop technical norms and standards and adapt them to their concepts. So in the area of leadership, policy, and partnerships, WHO is about leadership. It's about developing policies and partnerships. We provide global leadership and strategic directions on matters critical to safety and quality of health services. Okay? We actually have a special envoy for patient safety. His name is Sir Liam Donaldson, and he has said basically that, and I quote, "To make an error is human, to cover the error up is unforgivable, but to fail to learn from your error is inexcusable." Okay? This underscores the notion that patient safety and patient care must be a learning process. Okay? It is a process that involves continuous introspection and learning. We are involved at both global and regional levels. So our global headquarters and our regional office, which is located in Delhi, the Sierra Regional Office, is involved in promoting issues around patient safety. And we work to strengthen collaboration internationally and within WHO. We have led on initiatives like the Global Patient Safety Challenge, which I'll talk about in just a minute, and on other global advocacy campaigns. So one of WHO's roles is to put patient safety and quality of care on the global agenda. Okay, it's really to get the highest level commitment sort of toward the whole concept of patient safety and quality care. And it does this through, one of the ways it does this, that the WHO does this, is through the World Health Assembly, which I mentioned previously as one of the core institutions or pillars of the WHO. Again, this is the meeting, the assembly of all of the ministers, health ministers of the world, that occurs every May in Geneva. This is an example. This is a picture from the World Health Assembly. And an example is World Health Resolution 55.18, which is about quality care and patient safety, which passed in 2002. It was really the first resolution of its kind on patient safety that all the countries of the world agreed with. And the gist of this resolution was to request WHO to support the efforts of member states to promote a culture of safety and quality within their healthcare organizations. Okay? So what the member states, the countries of the world, asked WHO to do was through the development of policies, the development of guidelines, the collection of basic health data and information to support countries to promote a culture of safety and quality care within healthcare organizations. So this is, at WHO, we pass a lot of resolutions. We have a lot of documents. And these are all of the different types of resolutions and declarations on patient safety that have passed since 2002, okay? Some of them have passed at the World Health Assembly, okay? So I mentioned the resolution on quality of care, patient safety in 2002. And then so I think there was, at the World Health Assembly in 2004, there was the launch of the World Alliance for Patient Safety. There have also been a number of resolutions which are available on our websites and which I can provide for you, passed by the Sierra Regional Committees. So so we have a global World Health Assembly, and then we have what's called the Regional Committee, where the 11 member states of the Southeast Asia region meet every year, generally in September, and they also pass resolutions for the 11 countries, applicable to the 11 countries within the region. So 2 of those resolutions in 2006 and 2007 are about promoting safety, patient safety in healthcare, and of course the Jakarta Declaration on Patients for Patient Safety in the Sierra countries, in the Southeast Asia regional countries. And most recently, in 2015, a resolution on patient safety contributing to sustainable universal health coverage. So one of the programs that WHO has that I think is very interesting and that I think is worth mentioning is the WHO Global Patient Safety Challenge. Has anybody heard of this? You guys need to go to our website a little bit, I think, because this is actually very interesting, and it's basically a core program of what was called the World Alliance for Patient Safety and is now integrated into the Department of Safe Delivery and Safety at WHO. It's essentially a program of change aimed at improvement and risk reduction. And it's actually a series of challenges, and each challenge covers a topic that addresses a major and significant aspect of risk relevant to every country, okay? It blends evidence-based interventions with implementation strategies, and it seeks to achieve widespread engagement and commitment. So,
Oops, sorry, I already.
Did I get, oh yes, I nodded on, right, okay. Okay, so the first challenge was called Clean Care is Safer Care, addressing hand hygiene as a means to prevent the spread of healthcare-associated infections. This was a challenge that really showed people sort of established standards for hand washing, for instance, and sort of cleaner hand hygiene was one of the most critical elements in healthcare contexts. And it really also addressed the whole issue of nosocomial infection, which, for which hand hygiene is absolutely so critical. The second global patient safety challenge was called Safe Surgery Saves Lives, okay? This challenge focused on improving the safety of surgical care in order to prevent errors, avoid injury, and save lives, okay? So this came out shortly after the first one on hand care. So these global patient safety challenges have galvanized global commitment on important aspects of patient safety, okay? They've widely promoted the concepts of patient safety more generally, and they promoted novel approaches, especially around behavior change and the introduction of surgery checklists. I remember when I was working in Ghana, there was no such thing as any sort of surgery checklist. And so people would forget sponges in the patient's body, or they would, forget to look at the x-ray and they take out the right lung and not the left lung. And so we established these patient checklists, and they were actually very, 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 very useful. The third Global Patient Safety Challenge is planned for launch in this year, in 2017. And it's really addressing the whole concept of medication safety, to address unsafe medication practices and to improve medication safety across the world. So this represents the third global challenge for patient safety. So you can see that each one of these has addressed the major causes of adverse events in the clinical care context that I mentioned at the beginning of my presentation. The first global challenge addressed the concept of hand washing and in order to address the problem of nosocomial infections. The second was about improving the quality and the safety of surgical procedures. And the third, this one, will be about medication. So these are addressing the really critical problems and critical challenges that we have in the whole area of patient safety. So I've talked about leadership, and I've talked about some of the policies, and I've talked about the global challenge. WHO is committed to creating global partnerships for strengthening collaborations internationally. And WHO has a number of centers called collaborating centers. In Thailand, we have 34 collaborating centers in various specialty areas. I don't believe we have a collaborating center for patient safety, but certainly WHO has collaborating centers, universities, et cetera, that we work with. They have the clinical center for clinical risk management and patient safety in Florence. We have the network of hospitals in Geneva, Switzerland, and we have the National Arbitration Commission in Mexico. So we have a global network of collaborating centers that support us in the whole area of patient safety. In addition, as part of its convening role, WHO has organized a global consultation on setting priorities for global patient safety in late September of last year. I've actually met some of you already this morning who attended this consultation. The aim of the consultation was to cultivate a global expert think tank to identify key challenges, new directions, and hot topics for priority action in global safety over the next 5 to 10 years. About 140 participants from 30 countries attended this consultation. And really the event was hailed as a landmark for patient safety, advancing global thinking, informing leaders, setting standards, and helping set a new strategic direction for WHO and its global partners. There is also a WHO Global Patient Safety Network. This is an online platform for key stakeholders to share and discuss ideas, approaches, tools, and best practices from around the world. There are over 60 countries who participate in this platform and 400 members. Okay? So this is a wonderful opportunity for people in the field to discuss issues that they have, bring up solutions, bring up ideas, bring up challenges. Like I say, this network aims to stimulate dialogue, promote continuous learning, and create unique opportunities for contributing to improving patient safety globally. It's especially important for low and middle income countries. So I've talked a little bit about WHO global leadership, and I've talked about our role in convening partnerships. I talked about the meeting in Florence. I talked about the online platform that WHO has. We also have a role in promoting technical best practices, okay? This is a technical series on safer primary care. It consists of 9 monographs. These are available on the WHO website, which I'll give you at the end in case anybody's interested. They explore the magnitude and nature of harm in the primary care setting and provide practical solutions and practical next steps for improving safety. I think these primers would be very useful. If you're not familiar with them, would be very useful for you in your different clinical contexts. The primers really mean to raise awareness among member states about causes and consequences of unsafe care, provide interesting and accessible summaries about key issues, and help increase our knowledge about how to design and deliver safer primary health care. And of course, capacity building is very critical. We support education and training of the workforce. We build the capacity for patient safety among healthcare professionals. We've developed a multi-professional patient safety curriculum guide to strengthen academic capacity. And we've also provided comprehensive patient safety training for healthcare educators, leaders, trainers of trainers. So we're very, very much involved in building capacity, both from our headquarters level and from our regional level. And finally, we help member states collect information. We help them monitor the health situation and assess trends, metrics for patient safety. There are core 100 indicators for patient safety and quality, and these are also available to you on our website. So I wanted to talk very briefly about the Sustainable Development Goals. Everybody knows about the Sustainable Development Goals? Okay, these are really important because this is going to be the focus the Sustainable Development Goals are really going to be the focus of global development in the next 10 to 15 years. There are 17 Sustainable Development Goals. These Sustainable Development Goals replace the former Millennium Development Goals, which many of you heard about, okay? So where there were 6 or 8, I can't remember, Millennium Development Goals before, there are now 17 Sustainable Development Goals, okay? Goal 3 is about health, okay? It's about good health. But health is involved in many of the other development goals. Health is linked to many of the other development goals. So the Sustainable Development Goals are different from the Millennium Development Goals. They're very, very ambitious, okay? Before we had under 10, now we have 17, okay? They reflect real life. They reflect the real life problems that challenge us globally. There's a strong focus on equity. One of the bylines of the Sustainable Development Goals is leave nobody behind, okay? So everybody must benefit from the Sustainable Development Goals. The goals are interlinked. It will not be possible to achieve one goal without working on or achieving another goal. We're not starting from zero. There's already been a lot done, and I'm going to talk about that in just a second. But we do need to work across sectors, okay, to achieve the Sustainable Development Goals. This will be very, very critical. So you can see from this graph that this is progress on trends in maternal mortality in the Southeast Asia regional country, in the Southeast Asia countries, the countries of the Southeast Asia Regional Office of the WHO. And I think that what this slide shows is that there was in many parts of the world, in Southeast Asia, significant progress on the Millennium Development Goals. Okay, so these are trends in maternal mortality, and you can see across the region that maternal mortality went down since 1990, and really many of the countries in the Southeast Asia region achieved their goals, Millennium Development Goals in relation to health. Okay, so this is SDG 3. This is now the next generation. The goal is actually stated to ensure that healthy lives and promote well-being for all ages. So each of the 17 goals has a series of targets, okay? There are 9 targets for this health MDG. Some of the targets are what we call the unfinished agenda. So for countries that have not yet reduced the burden of child mortality, that have not yet reduced the burden of mortality, of maternal mortality, those MDGs that are not finished are now continued as targets within the health Sustainable Development Goals, okay? So it's not like we're forgetting the previous agenda and we're moving on now to something new. We're continuing with our work in the previous agenda. There are some new targets for SDG 3 that were not in the previous MDGs, and one of the most obvious to me is non-communicable diseases. Okay, nobody in the MDGs talked about NCDs, and yet non-communicable diseases, as you know, are a huge problem in developed countries and even in developing countries and in middle-income countries like Thailand. Okay, so there are a whole series of targets, and that's the box in the middle, on sort of some of the new challenges we have in the health sector. Target 3.8, I think, is really the most important one, okay? And it's all about assuring universal health coverage, okay? It's about achieving universal health coverage, including financial risk protection, access to quality essential health services, medicines, and vaccine for all, okay? And I've put target 3.8 up there because that is really where patient safety sits, okay? It really is all about access to quality essential healthcare services, okay? So for all of you out there who are working in the area of patient safety, it's important for you to know that what you are working on is on the global development agenda, okay? It's firmly entrenched in the new sustainable development goals, and you and I and our leaders will all be held accountable for progress made in this area going forward. I don't know where my last slide is. Oh, I had a last slide that I summarized a whole bunch of things. But anyway, I wanted to tell you that as I was preparing this presentation yesterday, I called up my headquarters and I said, what are sort of the 5 or the 3 or 4 main messages that you want me to leave with the audience that I'll be talking to? And basically, they really wanted me to leave you with sort of 5 things. And I think that the first thing, and I've touched on this during the presentation, is that when it comes to patient safety, enabling environments are key. Improvements in patient safety can be made with innovative, locally adaptive solutions, even in low and middle income countries. However, I wonder if I've got them here. No, I don't. However, it's really essential to create an enabling environment. If you're going to change the system, you have to create an enabling environment in order to make that change. The second is about prioritization. Patient safety has to be prioritized by you. It has to be prioritized by your hospital administrators. It has to be prioritized by ministries of health. It has to be prioritized by governments. It has to be prioritized by different sectors, and that's, again, part of the SDGs, the different sectors working together. The third is about organizational leadership. Governance accountability are absolutely essential to apply the patient safety strategies that we know work at all levels of care, from primary care right through to tertiary care. Fourthly, we need compassionate and competent leaders and a compassionate and competent health workforce. This needs to be created through effective education, training, and skill development. And finally, something I haven't talked very much about is the real role of patients in healthcare. This should be enhanced at all levels of the healthcare policy development, decision-making, health literacy. Patients' involvement in their own healthcare is a critical element of improving patient safety. So I think I've talked for a long time. I'm very happy to answer any questions you have as best I can. I should just again say that this is the WHO website. There is a whole webpage dedicated to patient safety. Many of the details of some of the global resolutions and some of the global initiatives can be found there. You're welcome to discuss them with anybody in our office. If you have any questions about them, we'd be very happy to meet you in our office if you'd like. I really want to thank you very much for your attention.
Thank you very much, Dr. Daniel.